If you've ever tried to build your own natural medicine cabinet, you've probably noticed that it's not the lack of options that creates the problem. It's not being able to tell what actually belongs in your day-to-day life and your routine. Most of it sounds helpful and is marketed as such, but it's rarely clear. In reality, you don't need dozens of tinctures in your medicine cabinet. A small handful, used well, can cover most situations people run into day to day. I'm Dr. Kenny, an IFM certified functional medicine practitioner, and I help people make sense of what their body is actually communicating and sifting through the noise of the wellness world. And in this video, I'll walk you through the 5 herbal tinctures that are actually worth keeping on hand, and more importantly, how I think about using them. Because this is the part that I see in my patients all the time, is they're often told what to take, but not how to interpret when or why that applies. So maybe they end up using the right thing at the wrong time or using something consistently without knowing what it's actually doing to move their chemistry in the right direction. And an important note is that just because something is herbal or natural doesn't mean that it's automatically safe or appropriate to use long-term without question. Herbs, just like other nutraceuticals and medications even, are tools. And like any tool, they can help or they can create new problems depending on how and when they are used. So instead of just giving you a basic list, I'm going to share with you a framework, a way of thinking, because when you understand this framework, the list stops being confusing and perhaps oversimplified and starts to make a lot more sense internally. And that starts with a shift in understanding what these tools are actually interacting with, not at the level of symptoms, which is where most of us live in our conventional paradigm, but at the level of your systems. The biggest shift I want you to make when you're considering herbal remedies is that your medicine cabinet is not a collection of isolated remedies for symptoms. It is a control panel. Each of these tinctures or herbs that we're going to talk about, when used properly, is interacting with a system in your body, sometimes a combination, not just used for a symptom. This is something we call green pharmacy, which is just replacing an herb or other nutritional substance for a medication to match with the symptom. And one of the most important connections to understand here is something called the gut-brain immune axis. At a basic level, your nervous system, your digestion, and your immune system are constantly communicating and deeply intertwined. Your brain influences your gut influences your immune system, and your immune system feeds right back to the nervous system and brain. And it's this intricate spider web. So when someone tells me that they're dealing with stress or poor digestion and getting sick more often, for instance, I don't interpret these as 3 separate problems that need a separate tincture for each. I often interpret this as a pattern that is showing up across multiple systems. And if you don't recognize that, everything starts to get misapplied or oversimplified, and you're chasing symptoms rather than supporting your systems. This is where herbal tinctures can be particularly useful, not because they fix anything directly, but because they help modulate how these systems are behaving. Many herbal remedies contain hundreds or even thousands of individual chemicals that are interacting with your chemistry, so it's rarely as straightforward as this for that healing. To modulate something means to nudge physiology in a direction rather than to override it or to go after a specific chemical that we shut down or upregulate in our chemistry. And that distinction matters because when we start to talk about nutrition and herbal remedies to promote healing, it helps to honor the complexity that each of these nutrients or substances truly bring inside of our bodies. Because if you misread the pattern and we're just living in what I call symptom land, even a well-chosen tool can push things further out of balance or miss the mark entirely. And that's why context, dosing, and how long you take these substances become non-negotiable when you're using these tools effectively. So when we step back and we look at this, put our little clinician hats on, you can start to see recurring patterns that most people were never taught to recognize in their own bodies. The 5 tools I'm going to talk about are not general use solutions. They don't apply to just stress or just digestion in a vague sense. They tend to line up with very specific patterns. Most people and our conventional paradigm treats these as separate problems, but again, they're deeply interconnected. So instead of asking, what should I take for this symptom? When we get into these tinctures, the more accurate question becomes, what pattern is this? And what system is driving it? And then what do I do to support it? So let's start with the stress predominant pattern, because whether someone recognizes it or not, this is almost always part of the picture. When people hear stress support, they immediately assume that it means something that just makes them feel calmer. But that's actually not what's happening here when we talk about supporting systems. We're talking about herbs that influence how your body responds to stress at a physiological level. This is where the broad category of adaptogens can come in. Adaptogens are a class of herbs that help to regulate your stress response, particularly through something called the HPA axis, or the hypothalamus, pituitary, and adrenal axis. It's the way the brain communicates and coordinates with the adrenals your response to stress. When the system becomes dysregulated through many different causes, we can get into that in another video, the experience is usually quite familiar. One of the most well-studied adaptogens is ashwagandha. A recent 2024 systematic review and meta-analysis showed that it significantly improved stress and anxiety scores and lowered cortisol levels in human trials. So this isn't just about feeling calmer, it's influencing the signaling within the stress system itself. And if you're one who does like the research, I've included a free research summary in the pinned comment in the description below. It goes over some of the studies that I included in this particular video. Easy to digest language, so you can dive into that yourself. Even though we have this systematic review and meta-analysis, which is a very conventional evaluation model, it doesn't mean that everyone is necessarily going to benefit from ashwagandha. And it certainly doesn't mean that it should be taken indefinitely and for long periods of time. If your cortisol rhythm is already low or dysregulated in a different direction, this can actually make things worse. And it's important to understand that context always determines whether something is supportive or disruptive. Context meaning your chemistry. So this is a tool, a useful one, but only when the pattern supports its use. Now here's the next layer. Let's shift into a more digestive problem predominant pattern. One of the most common places stress itself actually shows up is in the body's ability to digest. You might recognize it as bloating after meals, or heaviness, or that sense that food is just sitting there longer than it should, maybe constipation or looser bowel movements. In many cases, the assumption is that the food itself is the issue. So the focus stays on elimination, restriction, or changing what you eat. But more often than not, this pattern is different. The system isn't responding to the signal it needs to do its job effectively. The issue often isn't what you're eating, it's how your body is responding to it. The second herbal product to consider keeping in your cabinet is digestive bitters. Bitters are compounds, like they sound, that taste bitter. And that bitterness triggers a reflex throughout your entire nervous system, and most importantly, in your digestive tract. When your tongue detects something bitter, it signals that food is coming, and your system starts to prepare accordingly, including secreting digestive enzymes and even helping to signal and strengthen the GLP-1 pathways. Stomach acid also increases, as well as your bile flow, the mechanisms that are needed for breaking down food to be able to actually extract energy from them. And this isn't just theoretical. A 2022 meta-analysis of randomized controlled trials showed that herbal treatments in this bitters category improved symptoms of functional dyspepsia, which is a condition of the stomach, compared to placebo groups. Essentially, people with symptoms of bloating and heaviness and uncomfortable digestion, even acid reflux, experienced measurable improvement. But interpretation of this kind of study matters too. If you're using digestive bitters every day without understanding the pattern underneath, you may be compensating for a system that isn't signaling properly, rather than addressing why that signal is impaired in the first place. So the conversation becomes less about just taking something for digestion and more about restoring the signaling that digestion depends on. So when the stress and digestive pieces start to shift, the next pattern that tends to become more visible is in the immune function category. So let's shift to this pattern, because this is one of the areas where the language often becomes most confusing. Most people hear, and I can think of the context during the pandemic, that most people are looking for something to boost their immune system, but that framing is usually oversimplified and frankly inaccurate. The immune system isn't something that you simply just turn up. It's something that you help to regulate. In some patterns of this immune predominant pattern, it's underactive, while in others, it's an overactive immune system. Very much the Goldilocks principle here, where we want to find that natural normal set point. And in many cases, especially with recurrent infections like urinary tract infections or upper respiratory infections, or even allergies, it's simply inconsistent between being underactive and overactive. It doesn't respond proportionally to what's happening. This is where certain herbs can play a role as well, not by replacing immune function or simply boosting it, but by influencing how that response is regulated. Echinacea is a good example. A 2024 meta-analysis involving over 5,000 people showed associations between fewer respiratory tract infections, fewer complications, and reduced antibiotic use. So there is evidence here that supports that herbs can support immune resilience, particularly in patterns where the system isn't responding consistently. But boundaries and proper framing of this immune conversation matter too. Herbs and tinctures such as echinacea, these do not replace appropriate care in acute and urgent situations. If there's a serious infection, high fever, or worsening symptoms in an immunocompromised individual, for instance, that requires proper medical evaluation, and these tools operate in a very different context than that. Herbs and tinctures are often more useful before a pattern escalates or after in helping to reduce how frequently it returns or complications. We've looked at stress, digestion, and immune-dominant patterns in this axis, but there's another layer that often gets overlooked. What happens when the system is supposed to slow down? For many people, the predominant issue is not just the presence of stress during the day, it's the inability to shift out of that state, especially at night, which disrupts our cortisol rhythms. The system stays activated when the environment is no longer demanding it. What feels like a sleep problem is often a state or stress regulation problem. This is where the nervous system slowing down, according to regular sleep and cortisol rhythms, is relevant. And we're not talking about sedation here. We're not trying to force sleep, but rather supporting the body's ability to transition into a parasympathetic or rest and digest predominant mode. I'm going to give you a little combination tincture here because I love both of these herbs, passion flower and lemon balm. These herbs do not function like pharmaceutical sleep aids in most instances. They work more upstream, supporting things like GABA signaling, one of the primary inhibitory neurotransmitters or chemicals in the nervous system that calm your nervous system activity. So instead of simply inducing or forcing sleep, they reduce the friction that prevents the system from settling at night. Context determines effectiveness here too. If your sleep disruption is being driven by blood sugar instability or inflammation or other hormonal factors, this alone won't solve it. We always have to match the intervention to the underlying drivers. But when this pattern fits, this can be the difference between feeling exhausted and being unable to settle and actually transitioning to a deep restorative rest. And when we look across these patterns, there's another category that actually spans all three of the gut-brain immune predominant patterns. This final herb is what I would consider foundational or a cross-system support. A clear example of this is turmeric, specifically curcumin. This is one of those compounds that doesn't fit neatly into a single category. It shows up in discussions across inflammation, digestion, and nervous system function and immune signaling. That's because it interacts with multiple signaling pathways all at once. One of the most oversimplified interpretations here too is viewing inflammation as something simply that should be eliminated at all costs. Inflammation is not inherently a problem until it becomes uncontrolled. It can be a signal as well. The issue usually arises when that signal becomes chronic and persistent, or when it no longer resolves completely. At that point, inflammation can influence multiple systems: your energy, your digestion, your immune function, even your mood and mental health. Curcumin has long been studied for its role in modulating immune signaling and inflammation signaling pathways. Not simply shutting them down like an over-the-counter painkiller, for instance, but helping to regulate them. And like everything else we've discussed, this is a tool, not something that we indefinitely use without context and without a plan for exiting most of these prescriptions as well. And these herbs and tinctures definitely shouldn't be used as a replacement for identifying what is driving the underlying patterns to begin with. But when they are used appropriately, they can influence multiple systems simultaneously. So when you step back and look at what we've covered today, these categories are not random. They're different entry points or predominant patterns that you can focus on in the same set of interconnected systems. If you were expecting a list, this is often where the misunderstanding starts. I don't just want to feed you simple marketing language here, because this isn't really about 5 herbal tinctures. It's about how you interpret what your body is already communicating. And when that interpretation changes, the way you use these tools change with it. That's where the difference shows up when it comes to leveraging the power of herbal medicine. Because repeatedly managing or stifling symptoms and actually working, if you appreciate this perspective and you're starting to see your own patterns differently, that's usually where the real progress begins. And that's exactly what this video on your screen here will cover. Some of the primary differences, the different thinking caps you use between the functional and the conventional paradigms. I'm Dr. Kenny, Root Cause Health Detective. Thank you for watching, and I'll see you in the next video.